Furious protesters in Australia are objecting the rollout of the COVID-19 vaccine. The protesters gathered singing and chanting slogans. Say no to the prick. They are denouncing the vaccine. Peaceful rallies were being held in Melbourne, Sydney and Brisbane. In Victoria, demonstrators clashed with police, leaving the city at a standstill. The Victorian police had formed a barricade across the parliament, and some of the demonstrators tried to cross the line. This led to the arrest of several protesters. The Australians are now demanding for Premier Daniel Andrews' resignation. Data reveals that 40% of the United States population doesn't want the vaccine. Vaccines are the world's only hope for overcoming the COVID-19 pandemic. Scientists have moved closer to finding a potential cure, but there are still loopholes that need to be fixed. Recently, the Pakistani Prime Minister Imran Khan tested positive for COVID just 2 days after getting vaccination shot of the Chinese vaccine Sinovac. In India, till 18th February, 32 people lost their lives after getting vaccinated. There is another controversy brewing in the Johnson & Johnson vaccine about the morality of using fetal tissue. The Johnson & Johnson vaccine uses cells that are part of its existing manufacturing process. Even in Pfizer and Moderna, it uses specialized cells originally derived from aborted fetal tissue. Though they are not ingredients in the shots themselves, but they're used in testing or making the vaccine. On Thursday, Denmark, Norway and Iceland temporarily suspended the use of AstraZeneca due to concerns about patients developing post-jab blood clots. The World Health Organization said there was no established link between the vaccine and blood clotting. Covishield, a vaccine produced and distributed by the Serum Institute of India, is also expected to undergo a review this week. It is first time in human history that a vaccine has been developed in response to a global pandemic at this pace. Emergency use clearances have been granted, but these are not easy calls for the scientific community or the governments. Many are asking if it is essential to take the vaccine. Many say that the atmosphere of fear is being created for people to take the vaccine so that pharma companies benefit in connivance with corrupt politicians. But many others say that taking the vaccine isn't a choice. Bureau Report, Democracy News Live, New Delhi.
Good evening, I'm Rohit Gandhi. I welcome you all to our series on COVID Part 7. We decided early on that information about COVID and humanity's fight against it will take quality information. So we decided that we will bring the experts from all over the world to make sure that you have accurate information about the vaccines. We maintained from the very beginning that the misinformation that people push out to gain biased viewers is not our idea of great journalism. So we stayed away from finger pointing to blame nations or people. We did not back one vaccine or another. We don't get paid for doing our journalism. We're not selling vaccines. Our job is to help the world have all the correct information about how we will get past the pandemic. So here we are with guests who are sitting at the epicenter of the development of the vaccine. Today, we're going to talk about how far we've come in this global fight against COVID-19 pandemic. Controversies around the different vaccines are all over the internet. They've become a major discussion issue. On one end, we see anti-vaccination protests. On the other, we see some vaccines showing reactions and teething issues. You have to remember that COVID-19 vaccine has been developed at a pace never achieved before. So today, let me bring in our guest, Dr. Jerome Kim. He is the Managing Director General of International Vaccine Institute. He's in Seoul, Korea. He's an international expert on evaluation and development of vaccines. Also joining us today is Dr. Sridhar Ryavanki. He's a health specialist at UNICEF and is in Chhattisgarh. Also joining us is Dr. Pavithra Venkatagopalan. She has done a PhD in coronavirus studies, and let me not confuse this because her coronavirus study was done between 2006 and 12, and it is not the novel coronavirus. It's a different strain of the virus. Also joining us is Dr. Shreevidya Venkatraman. She's a senior consultant at MGM Healthcare, Chennai. She'll join us later in the show, but let me start this with a question to Dr. Kim. Dr. Kim, when you see these protests taking place in Australia, what's your first reaction? Are people overreacting there?
I think that we, as a medical community, have to respond first with the science. We have to talk about how the vaccines are safe and efficacious. We have to make vaccinations easy. We have to make it easy to get a vaccination. We have to put a lot of positive socialization around it. And we also have to create a motivation in people to want to be vaccinated. And governments, as has often been the case during this crisis, have had a long time to prepare. We're 13 months into the pandemic, and people had unopposed bad news, misinformation being spread on the internet and via other social channels. And governments did not organize to put the right information out there. We have to be able to put positive, we have to be able to lead with the facts. And the facts really support the safety and efficacy of these vaccines. And combined with continued use of masks and distancing are the best way to finally control the pandemic and hopefully prevent the generation of new mutant viruses.
Dr. Kim, you're taking a route where you don't want to criticize people protesting against it. When you see the protest, do you feel the reaction is a bit too much?
People have different motivations, and sometimes the likelihood that other people will take the vaccine appears to increase. And we will finally get to a group of people who will resist vaccination, to their last breath. And, we have to work to try and vaccinate as many people as possible to achieve a level of protection in the community that will protect everyone, vaccinated or not, from COVID-19. That's the goal. And we can't lose sight of it. And we can't be distracted by, by what people say about us or about what we're doing, because we know that science and medicine are on our side.
Sure. Dr. Pavithra, let me bring you in here. Can you, tell us a bit about when you're, meeting patients, you're talking to people, are people worried even in India about getting vaccinated?
Yes. With social media being so rampant and it's just in your hand with your phone, every information travels around the world very quickly. And when one population starts getting nervous about getting vaccinated, the same kind of fear gets transmitted among everybody. So yes, in India too, people are, like Dr. Kim said, a lot of people are saying, let me wait to see how others are doing. But once one person starts taking the vaccine and then they put their photo on social media, then their friends see it and want to go get vaccinated. So while there is definite skepticism in even a well-educated group of people, more and more people are warming up to the idea of getting vaccinated and basically realizing this is the way to end this pandemic, is to take the vaccine.
Right. No, absolutely. And I think there are a lot of people, we've heard a lot of information and misinformation. One small thing comes out and then everybody starts saying, oh my God, this vaccine should be taken. It ends up in clotting, you get heart disease. You hear all kinds of misinformation. And, my mother has taken the vaccine, which I know a lot of other seniors have taken the vaccine. They've all come home. They've absolutely been fine. No side effects, not even like a little bit of fever sometimes, which doctors say that you may get a little bit of a side effect, a little fever,
right,
but none of that at all.
Right.
So really, there are a lot of people who are out there who are able to, you take the vaccine and they're fine. Let me bring in Dr. Sridhar Ryavanki. Dr. Sridhar Ryavanki, you're in Chhattisgarh, it's in central India, just for people to understand. Explain to me, is there a sense of worry amongst people, or people are all out, want to get vaccinated and get it done? I don't hear Dr. Sridhar. I don't know if it's in...
Are you able to hear me now?
Yes, Dr. Sridhar, go ahead, please.
Yeah, see, vaccine introduction in India was very well planned, and communication planning is an important part of vaccine introduction. And in communication, they had 4 pillars of understanding of COVID vaccination. What would be the issue from the demand side? And 2 things were very clear. There would be vaccine hesitancy initially, and there would be vaccine eagerness afterwards. So that is what we saw. When there were some confusions regarding Covaxin and Covishield, when it was introduced, that Covishield has completed phase 3 trials, but Covaxin has not completed phase 3 trials. So that hesitancy was there initially, but fortunately in the state of Chhattisgarh, only Covishield vaccine was introduced. And we did not see much of vaccine hesitancy in the state of Chhattisgarh. And I think Chhattisgarh was among the top 3 or 4 states which had a high coverage of vaccination among the healthcare workers and the frontline workers in the phase 1. And in the phase 2, we have more than 600,000 people already vaccinated.
So that's a good sign of, what the kind of steps you've been able to take. Now let me bring in Dr. Shreevidya Venkatraman. Dr. Shreevidya, when you talk about, and you've seen the studies around it, in terms of the efficacy of this vaccine, when people talk about 80%, 90%, 96%, what does that mean? A lot of people have been asking me this question. Is it efficacious in 96% of the population that takes this? Can you explain that concept to me a bit?
Good evening, Rohit. Thank you very much for having here. Yeah. So that's a very, very diabolic statement that the pharma company put it out, saying that it is 60% efficacy or 85% after the second dose. What it exactly means is that if we vaccinate 100 people, we can very safely say that 85% of them will not get COVID infection. What I can say from my experience is that the rest of the 15% will only get mild COVID infection, because right now we are seeing in public that they are between the 2 doses. Even those who have received the first dose are coming to us with in between COVID infection, but they are very mild. Those who have received COVID vaccine are coming back with very mild COVID positivity or very mild COVID infection. So that exactly what it means is that out of 100, 85 people will get, 15 people, 85 people will be fine, 15 people will be get affected.
They will get affected, but it will still just be a mild infection, and then that will subside.
Yes.
Mostly.
That's exactly.
That's what we're talking about.
Yeah.
So Dr. Kim, if I may bring you in here, when people say, that means an 85% efficacy or even a 70% efficacy, is that good enough is my question.
That's actually a great question. And I think one of the things to remember is that when we design these trials, the question that we're asking is very important. And these trials almost to a T asked one question: does the vaccine prevent mild, symptomatic, PCR positive disease? So mild disease with symptoms. But that's not actually what we're interested in. If you're a country, say you're India, what you want is to keep people out of the hospital. You want to prevent severe disease and hospitalization and death. And it turns out that the vaccines are much better, as was just mentioned, at preventing that form of severe disease that puts people in hospitals and causes them to die. So in a sense, if you think about COVID-19 disease as a tiger, tigers will make 15% of people sick, put 5% of people on ventilators, and 1 to 2% of people die. What the vaccine does is it turns COVID-19 into a stray cat. Very few people get sick and very, very few people die. And that's the difference. These vaccines are doing remarkable things, and we actually have data now from countries that have successfully implemented, have successfully vaccinated significant parts of their population. We're starting to see an impact on overall morbidity, that is the amount of severe disease, the number of hospitalizations, and then ultimately the number of deaths. So we are starting to see that the vaccines are effective, as well as being efficacious in protecting individual people. They're now showing some benefit for populations as a whole, and that's what we really want to see.
Dr. Kim, my next question is to you as well. The new virus strains that are coming out, we saw first in the UK, and then they started talking about it coming to South India and many other parts of the world. And then obviously there has been conversation around the second wave. Is this going to, I know we've spoken about this before, just for audience's understanding, are these strains going to continue coming out faster and faster? And will then the vaccine become redundant, and that means we will require another vaccine sooner or later?
Yes, so that's the $64,000 question. Right now, based on the data that we have two vaccines, Novavax and Johnson & Johnson, that appear to be directly effective against the South African variant, which is great news. And all of the vaccines are effective against the UK variant. Again, good news. We have test tube evidence from multiple vaccines, including the one from Serum Institute and from Pfizer and Moderna, and from Sinopharm, one of the Chinese vaccines, that the vaccines generate protective protein responses. We call them neutralizing antibody responses. These are proteins that the vaccine induces that bind to and inactivate viruses. And the data from the test tube study suggests that the vaccine should work against the currently identified mutant strains. And I think you made a very good point there by saying, what do we know? Well, there's a lot that we don't know. There are parts of the world where we aren't doing sequencing. So we actually don't know what variants are there. When the United States started to look, they found some variants of interest in California that they would not otherwise have known if they hadn't been doing, sequencing. So again, we have to do sequencing of viruses from all over the world and really stay on top of the variants. The final point is that the variants are created by these uncontrolled outbreaks. So to the extent that we wear masks and get vaccinated and continue to wear masks, we limit the spread of the COVID-19 virus, we limit the size of pandemics, we limit the generation of variants. So this all works together, both to protect society, to prevent the generation of variants that the vaccines may not work against. And if that fails, then we'll need, as you said, to probably add additional valencies to add additional vaccines to the vaccines that we have, kind of like what we do for flu.
Sure. Dr. Pavithra, if you can weigh in a bit here. Let's say that the next variant of the vaccine, if at all it does come out, is in much later. Now, what is the response of the population going to be if they find out that this may not be the last vaccine that they need to take? And since you're a virologist yourself and you've studied all of this, what is the likely chance that the variants become that large that a second round of vaccine may have to be developed?
We only hear about the UK strain and the South African and the Brazil variant. There is actually a website called Next Strain, and that is tracking all the different mutations that have evolved from the original COVID strain that was identified and sequenced. There's like 1,000 different variants. The thing is, most of these variants are insignificant when it comes to the effect of vaccines on them. Whether there will be more variants created, and like Dr. Kim said, it will be if we allow the virus to replicate more and more. If we can get a little bit technical here, every time the virus makes one copy of itself, it introduces 3 mutations in its genome. That's not particularly error prone. It's actually a reasonably very stable genome. So the more we allow it to replicate, the more number of copies it makes itself, which was what happens in these outbreaks, the higher the chance of new variants that can evolve and maybe prove a challenge to the currently existing vaccines. So regarding this, we take tetanus shot every few years. We take a flu vaccine every year. So I don't see why this should be any different. it'll take a while for people to get their minds wrapped around the fact that just like children have vaccines in periodic intervals, adults too have to take it, say, once a year. And we can only be doing this if we are aware of the variants that are currently circulating. Unfortunately, a lot of people think, let me wait for that vaccine that's effective against all the variants. They're going to keep waiting for that vaccine because it's never going to be there. It's the pot at the end of a rainbow, basically. We just have to go with what's best available at this time, protect ourselves, reduce the chance of the virus replicating some more by keeping ourselves and maintaining vaccinated and wearing a mask and maintaining distance, so that over time we reduce the chance of new variants being introduced.
Yeah, very, very important point there. So making sure that you take the vaccine as early as it's available, and to continue to protect yourselves, maintain social distance, maintain hygiene, low stress, and your immunity high. Dr. Venkatraman, let me bring you in here. Explain to me, when people talk about different variants and people discuss the idea of different vaccines availability. Is there this whole vaccine racism which is taking place in many, many ways, where one vaccine is better than the other, or should I take this vaccine or should I take the other vaccine?
Matter of vaccine apathy, especially in India, we are not very happy with any type of adult vaccination. There is no concept of adult vaccination in India, at least. Where do we take flu vaccine? Like Pavithra was saying, we do not take flu vaccine every year. We don't want to spend that 750 rupees per year. We don't want to take typhoid vaccine once in 3 years in India at all. And these are endemic things to our country. So when we talk about Covishield getting introduced to India first, and now we are in a phase where we have two options. So our elder senior citizens are saying, I am facing this every day. They're saying that I come with the mindset saying I'm only going to take Covishield. Now you're saying that I have to take Covaxin. So I take that 10-15 minutes and tell them that it doesn't matter. We are in the middle of a pandemic. Both vaccines are equally efficacious. There is no different side effect because they are both viral vaccines. Variation wise, I think both are equal. Covaxin is covering the UK variants also, and how efficacious they are, only time will tell. So whether it is Janssen & Janssen which is going to come out with first shot, or the nasal vaccine which is going to come out, I think we have to wait in time. But if any vaccine is available now, just go ahead and take it, is what we are trying to tell to most of them. We're trying to tell the masses.
Right. Dr. Ryavanki, if you can shed a little light on when you hear about these strains, and what is the impact of COVID-19 in rural India. And when I go out to rural India today, I was there just 3 days ago, I saw literally people with no masks whatsoever. The concept of social distancing didn't exist. Nobody was cleaning their hands. People weren't carrying sanitizers anymore. Is Chhattisgarh also one of those places where people have just gotten over the idea, said, I don't think this COVID-19 exists and I don't need any cure around it? What is the situation in Chhattisgarh?
Yeah, Rahul, this is the situation. I don't think it's specific for Chhattisgarh, but also, as you said, any rural India you go, it is something called as pandemic fatigue. So initially, when we had a few cases in the month of March, April, and when there is a lockdown, the number of cases we had in the entire country, now we have so many cases every day reporting in the state. But the complacency among the public has reduced. And particularly in rural India, when we speak, they are least bothered. When we talk about being hungry or dying, they prefer that they have to work so that they fill their stomach, and they're not bothered about what strain is coming, how pandemic is increasing. And that is where it is a critical role of the government, the partners, the NGOs, the volunteers, try to keep the momentum on, because the gains what we had over the past 1 year with the successful implementation of COVID response and also now COVID vaccination, that should not be lost. And we need to keep that persistently, and the communication planning helps, political leaders helps, the message from the celebrities helps, And that is how weekly the state is planning new activities, bringing new person to get vaccinated, new way of putting the messages on into the public, so that they continue to do the COVID appropriate behaviors irrespective of COVID vaccination. And that is how it is. We need to at least sustain for next 6 months to 1 year till we vaccinate majority of the people.
So what you're saying is that it's not as if there is higher immunity in rural India and they will be impacted equally just like anywhere else in this country or anywhere else in the world with the COVID-19 virus. Is that what you're saying?
Yeah, obviously. Now that initially many hypotheses came, the states, the countries where BCG was rolled out, so they had less number of cases. The countries which are developing countries, they had less number of cases. The cases where countries where malaria was endemic, the cases are less. For example, in the state of Chhattisgarh, we have a southern part of the state of Chhattisgarh, which is the Bastar region comprising of 7 districts. It is highly endemic for malaria and sickle cell disease. And in the initial pandemic for 5 to 6 months, we had no cases. And such type of hypothesis was coming. We are rural India. We have better immunity because we live in unhygienic conditions. But despite that, if you see the number of cases distribution, it was just a matter of time that it spread from metro cities to 2-tier cities, and now it is spreading to tribal and rural areas. So COVID doesn't differentiate between rich and poor, urban and rural. So everyone should be aware of it and take precautions accordingly.
All right, now let me go to the last section, which, to Dr. Kim. Dr. Kim, lots of, ideas around the reactions that the virus has had, side effects, clotting, all of those ideas. Explain to me, what should people be looking at, and is there something to be worried about with all the negative news that floats in on social media?
So it's not only on social media, though. I think, there have been credible cases of these blood clots that have first actually been uncovered in Europe. The Germans and the Norwegians appear to have found an answer in that the syndrome itself resembles a syndrome that's sometimes seen when we use the anti-clotting drug heparin. And no one understands why it happens. In Germany, it was primarily in women, and there was some concern that, this illness could be something that affects primarily younger people. But we still don't have the exact clue as to what's precipitating it. But when they look at large data sets, so when you're looking at vaccine safety, what you want to do is look at the signals over the entire group of people who are vaccinated. They don't see an increase in this blood clotting disorder. So whatever it is, it appears to be very localized and very rare. And so I think the bottom line here is that the WHO and the EMA, the European Medicines Agency, have said that the vaccine appears to be safe and efficacious. They don't see a signal of increased blood clots. They are looking into what is causing these outbreaks, which are very well and very clearly demonstrated. And they don't have the exact answer yet, but they are, again, pretty rare. And in the context of the huge outbreaks that are happening again in Europe, the risk of the benefit of vaccination far, far outweighs the risk of vaccination.
Dr. Pavithra, the information around, reactions for people and what it can do sometimes takes away from, a lot of people trying to, get vaccinated. The misinformation floats, and then, the grapevine starts. How does one kind of stem this? Have organizations like the WHO or the EMA, have they lost some sense of credibility? I see people don't seem to trust many a time, organizations like WHO even anymore.
When the outbreak started, there was a lot of criticism, especially one that was spread quite loudly by the former president of the United States, that WHO acted in collusion with the Chinese government. So there is no matter where you're from, when you hear someone from a position of credibility, not a credible person but a position of credibility, you tend to think that there is some weightage to what they say. So a lot of people came back down and said, but I don't want to believe the WHO. But WHO is still the premier organization when it comes to world health, because that is literally what they do. And there is no, their only goal is to make sure you and I are healthy. There is literally no other goal associated with it. So when we start questioning the credibility of these organizations, we're going down a wormhole where you end up going completely crazy and not trusting anything or anyone. And when these misinformation comes out, you tend to believe that because you want to believe that your mind becomes biased towards that.
No, I take your point there. The Dr. Sridhar, could you please explain to me what would be your recommendation to the people around you, or what should be the first steps, and by how long is it going to take to have India vaccinated? Is there a sense of how long this is going to take?
Yeah, currently we are vaccinating more than 1 lakh per day in the state of Chhattisgarh, and it is almost we are reaching 20 to 30 lakhs per day at the national level. So at this rate, if you calculate now, this we are introducing in the phase manner, so we cannot calculate what rate we are vaccinating currently and multiply it for multiple months. So then the calculation, mathematical calculation, goes 10 to 12 years. But that is not so. Now we are in the phase 2, and when phase 3 is introduced, and now when it is open in the market, definitely to vaccinate 60 to 70% of the population with the availability of the vaccine in the market, upgrading our strategies in future, somewhere at the end of this year, we may be able to vaccinate a substantial amount of population of the country. And my recommendation or suggestion or an appeal to the people is what Pavithra said. Whatever is the vaccine, whatever it is available, believe in science, not in rumors, and go and get vaccinated, whoever is eligible. Everybody is eligible because the phase 3 trials are not completed. We are not giving it into pregnant women and children less than 18 years. Rest everybody is eligible, but government has prioritized age groups because let them take first. So now, as a parents, they had responsibility. They vaccinated children. Now it is the responsibility of the children that they get vaccinated. Their parents, whoever is eligible. So go and get vaccinated, but don't forget, taking vaccination doesn't prevent the pandemic at current. Still, you can get infection. Still, you can get you can spread. So, irrespective whether you are vaccinated or not vaccinated, practice COVID appropriate behaviors. Only 3: maintain the social distancing, hand hygiene, and wear a mask. So that is my appeal.
Dr. Venkatraman, my last question to you is: when we hear about a second spread, a new strain, and shutting down places is also becoming a possibility. People have been talking about there may be more locks proposed, that people may go into lockdown mode again. Do you see that unfolding? Do you see that number suggesting that we may have to go on for further lockdowns now?
So whenever there was a lockdown, we went into a phase, a waning and a waxing last year. Whenever there was a lockdown, the cases will go down the minute you open the lockdown. But this is happening because people are not becoming smarter every time. The very fact that we are into a second surge and a second wave is because we went into caution fatigue. We threw away all the masks and we realized that we are not doing. Yes, some amount of lockdown. I think I'm going to say this at the peril of another economic low for the country, but yes, I think some amount of lockdown is going to be mandatory, like avoiding, closing down pubs, closing down public houses, malls, theaters, restricting marriages, crowd, funerals. I don't know how much I can say about political rallies, but I think funerals, marriages, and political rallies were where we got the initial wave of patients came from. So yes, some amount of, may not be 100%, but some amount of lockdown is in the pipeline, definitely.
Sure. Thank you, Dr. Jerome Kim. Thank you, Dr. Venkatraman. Thank you, Dr. Pavithra. And thank you, Dr. Ryavanki, for weighing in and helping us understand where we are with the COVID-19 virus and with the vaccine. What we have to remember is that this pandemic is one of those pandemics which humanity has fought together. It has fought together to make sure that we can get over this as fast as possible. Never in the history has a pandemic been dealt the way this has been dealt with, and the fight for this pandemic is going to be a joint one. And going forward, there are new platforms that have been created where there will be vaccines for diseases that will come in the future. And I think that's one of the biggest wins out of this pandemic, that the world has come together. Now, what is essential and is required is the world to align on the vaccines and how they will, create vaccine passports so that people can freely, float across the world again and continue living the life that the world was living. But at the same time, being careful is going to be part of who you are, and that's the future and how people are going to, interact, and people will still have to be careful and maintain hand hygiene and wear masks. So that's the way forward. Thanks for joining. Good night and good luck.